Have you ever wondered what happens behind the scenes when you visit the doctor's office here in the US? Who makes sure that your doctor gets paid? What happens when you see this doctor, and how exactly does your insurance company know that you were seen at the doctor's office? That is exactly where medical billing and coding comes in. Hello, my name is Jasmine. If you are new here, I'm excited that you're here. Here in this space, we focus on alleviating the stress and confusion in the business of healthcare. We do that by helping educate you on all that happens in the background of the healthcare system here in the United States of America. We also provide training and resources to those individuals that are interested in serving in the administrative side of healthcare in areas such as medical billing, front desk, and so on. If you're interested in getting connected, we would love to connect with you. All those links can be found in the description box below. Back to our topic at hand. So, medical billing and medical coding sometimes are smashed together, and people think that they are the same thing, but they are not. Medical billing is the process of communicating services and procedures that are done in a medical practice or organization and getting those services and procedures communicated to our insurance carriers so that money can come in. I like to think of that as translating charges, services to dollars. Medical coders precede the process of medical billing. Medical coders are translating the actual things that were done with our patients, those actual procedures and services that were documented by our providers within the practice or organization. They are translating the documentation into the billable language, the language that includes procedures and diagnosis codes. They are using that language that only can be used to communicate the services to our insurance carriers. So medical coding is translating that documentation into a language that then our medical billers can use to put on our claims that then gets sent to our insurance carriers for payment. Okay? Medical billing and medical coding work hand in hand, but they are different. One is translating services that were done and documented into billable procedure codes and diagnoses. And this one over here, the medical biller takes said services that were translated into those standardized codes. Here in the US, we use different types of codes that communicate those services and diagnoses in a more consistent way. They translate that from our coders and send that information to our third-party carriers so that hopefully we can receive payment in return. The whole function of the medical biller and the medical coder involves this function that we call the revenue cycle here in the United States. This revenue cycle is the way that money moves within a healthcare organization. We have other videos here on our channel that talk more in detail about the healthcare revenue cycle, but it essentially takes our patient from zero, moves them into providing services, and hopefully at the end of our cycle, equates to dollars that are received for said services that were provided as a result of that patient having insurance that is billed for services, or perhaps the patient is paying out of pocket for said services. But that money that is generated because the patient was treated by a practice or organization needs to be submitted somewhere, whether to patient or a third party. And at the end of that patient's cycle, the way they move through that organization, hopefully it results in a zero balance, which means we get some sort of reimbursement so that the patient ends up back at zero and does not owe anything, and that third party does not owe anything for the services. So why is this important? Medical billing and coding is important because it helps to ensure that our providers are reimbursed and reimbursed for services that were actually provided, services that the coders have determined were, in fact, communicated accurately within the documentation. The other thing that medical billing does is helps to ensure that our claims are hopefully processed fairly by our insurance carriers because they are going to be utilizing standardized codes that the insurance companies also understand. We also are using the medical coding and billing process to ensure that our patients' health and financial records are consistent and as accurate as possible. Here in the US, we really have two types of billing. We have what are called professional billing, which are things like for physician services and outpatient claims, things that you would typically see in a doctor's office. And then we have institutional billing. So that includes hospitals, nursing facilities. Those types of billing are done on different forms. Those two different forms are also going to include different codes and information to communicate what exactly was done and where it was done. Medical billing and coding is a part of, again, of a whole system that we call the revenue cycle here in the US. We have a ton of information here on the channel. And again, if you are interested in learning more, we would love to support you in your journey at Inlera University. We have so many different courses and resources that you can tap into, as well as communities that can help support you in your journey in healthcare. Medical billing and coding is truly the backbone of the financial arm of our healthcare practices and organizations. They help to make sure that these practices and organizations get reimbursed for the services that they are providing. If you are interested in learning more about specifics with regards to medical billing and coding, please let me know in the comments below. I love answering your questions. I love making sure that you are crystal clear. I also would love to get connected with you, so find us on all the social platforms under Inlera University or Inlera U, depending on your platform. All those links are in the description box below. My friends, thank you for hanging out with me. I will see you in the next video. Take care. My friends, if you're interested in learning more about that revenue cycle as a whole, I'm going to link a video right here.